Good day to all of you. I'm Dr. Yong here, an eye doctor from Summer Specialist Center, Damansara. Thank you very much for giving me an opportunity to share with you the importance of eye check in person living with diabetic mellitus. In this presentation, allow me to explain to you why, when, and how to get your eye check if you are living with diabetic mellitus. Diabetic eye diseases is a group of diseases that relate to diabetic mellitus itself, and the top three of it are diabetic retinopathy, cataract, and glaucoma. In diabetic retinopathy, high sugar level in the body will cause harm to the blood vessels in the retina. The retina is a layer of the tissue in the back of the eye that is sensitive to the light. It is similar to the film in the outside of the camera. It is actually the most common cause of vision loss for people with diabetes, and we will focus the talk today on diabetic retinopathy. Before going into the details of it, let's talk about the other two conditions that are well known to many of you, cataract and glaucoma, that can cause by diabetes as well. In cataract is actually as an eye condition where your eye lens get cloudy and make your vision blurred. If you have diabetes, it is 2 to 5 times more likely to develop cataracts. It also makes you more likely to get them at a much younger age. Treatment of cataract is straightforward. With surgery, there will be no recurrence after the surgery for cataract. For glaucoma, it's a disease of the optic nerve. Optic nerve is similar to the wire that connects the eyes to the processor in the brain for you to see the things clearly. If you have diabetes, it doubles your risk of developing glaucoma, and if left untreated, your visual field will be constricted, and in the late stage of the disease can lead to blindness. Glaucoma can be treated with both medicines and surgery. Now back to the main focus of today, diabetic retinopathy. Over time, too much sugar in the blood in diabetes can lead to the leakage or the blockage of the tiny blood vessels that nourish your retina. If the leakage happens in the center part of the retina, we call as a macula, it will affect the center sharp visions and cause the drop in the visions. This condition, we term it as a diabetic macular edema. On the other hand, the blockage of vessel will cut off the blood supply. As a result, the eyes will attempt to grow more new blood vessels, but all these new vessels are not good and will not develop properly and will leak even more. These new vessels have grown on the surface of the retina, will cause a bleeding into the eye and blocking your vision badly. So the previous discussion should explain why the diabetes can affect your eye and vision, especially on the diabetic retinopathy. But you may wonder now, if you have no vision problem, but you do have diabetes for now, why should I see an eye doctor? Firstly, it's because diabetic retinopathy is very common with the alarming fact that it has no early warning sign in the early stage. Diabetic retinopathy can damage your eyes even before you see the changes in your visions. Left untreated, diabetic retinopathy can cause vision loss and it can be permanent and irreversible if we detect it late. It's the leading cause of blindness in Malaysia working populations. And on top of that, early recognition and early treatment will not only delay the onset, but also will delay the progression of the disease. So you may ask, when is the best timing for you to see an eye doctor if you have diabetes? As shown here, the best time is now, which means that at the time that your family doctor or your physician's doctor told you that you have a diabetes. The main reason for this are almost 50% of diabetes patients are not aware that they even have the disease. And most of the time, the diagnosis of diabetes, when it made, was quite delayed. And we know now over time, more than half of the people who are living with diabetes will develop retinopathy in one day. There are two groups of patients with diabetes that we will research some extra considerations on the timing of eye check. First group is a child with diabetic mellitus, which are usually belong to the type 1 diabetes. The first screening may not need to be done so early, but it has to be done around the age of 10 years old, plus or minus 1 year. Depends on whether the duration of the diabetes is more than 5 years or not. So if you have a diabetes more than 5 years and reaching 9 years old, you should have your first eye check at 9 years old itself. If the child has a diabetes for just only 2 years, you can still wait for slightly later, around 11 years old, for your first eye check. Another group of patients is diabetic patients that are planning for the pregnancy. Should have their first eye examined prior to the conceptions. And if you are pregnant now, you need to have your eye check every trimester, which means that every 3 months during your pregnancy. If your first eye examinations reveal that everything is normal, we are definitely happy for you, but please don't forget that eye examination needs to be repeated every year. If unfortunately we have detected some early evidence of the diabetic retinopathy, The interval for follow-up assessment should be decided based on the severity of your eye conditions. Next thing that I would like to talk is how to get your eye check for the diabetes. The eye check is very simple and painless, but the eye doctor will need to give you some eye drops on the day of the visit to dilate, widen your pupil, and then only we can check your eyes properly. So during the examinations, the few eye drops are placed in your eyes to dilate the pupil. Then a special lens is used to look at the retina and the blood vessels. Please take note after the examinations, your vision may be blurry for a period of hours, and usually I will advise my patients to arrange a transport or driver when they come for the diabetic eye check. We may also take the picture of your retina using something we call a fundus camera for the assessment and also the comparison during the next follow-up. So this is another how. Lastly, another how is to talk about how to prevent and how to get treated if you have a diabetic retinopathy that affect your visions. To slow or to prevent the development of diabetic eye disease, you need to keep your blood sugar, blood pressure, and also blood cholesterol under control. And again, have the regular eye exam to check on the eye disease. At the same time, improve for your body weight management, do more exercise. And for those who smoke, you have to quit the smoking because all these are the modifiable risk factors that can delay the onset and also the progression of the diabetic eye diseases. Just a brief idea that I would like to explain here regarding treatment of diabetic retinopathy. When the disease is threatening your vision, the treatment options are including injection of the drugs into the eye, some laser treatments, and lastly, if you have no choice, you have to go for the eye surgery. These are the local and overseas reference for my talk. Yeah, I would like to thank you again for your attention, and I would like to welcome questions.